Continuing with the coronavirus patients who've been betrayed, from Coleman Cuts the Mustard. These are his words. He was speaking about the dentists in the previous clip, and now we're going on to the other comments. The bottom line is that patients who think they might have cancer are not being treated, even though everyone with a basic diploma in emptying bedpans knows that speed is of the essence when treating cancer. That is why doctors arrange screening programs. For heaven's sake, patients who had the first signs of cancer 3 months ago will, whatever happens, have to wait another 3, 4, 5 or 6 months for treatment, while the system catches up with the backlog. Vernon Coleman said, "My wife has breast cancer. Last year she had surgery and radiotherapy, and now she has constant pain in her shoulder. It is a common consequence of the treatment, and it can be treated with physiotherapy. But the hospitals are shut, so she struggles to do exercises, which don't make much difference. She is also due to have another mammogram, but she has not heard a word from the hospital about that, and we cannot get the physiotherapy or the mammogram done privately because the government has commandeered all the private hospitals just in case it needs them for coronavirus patients. It has not needed the hospitals because the predictions made by the mathematical modelers were absurdly pessimistic, and so the hospitals are empty, and the staff do not have anything to do except on Thursday evenings when they lighten their week with a little brisk clapping to congratulate their colleagues in the health service, who also have relatively little to do because the government admits that most of the hospitals in Britain are half empty. If you detect a slightly bitter note in all this, then give yourself full marks. I am angrier than I've ever been, and I am incredibly disappointed with the way patients have been betrayed. A friend of ours who was diagnosed with cancer a few months ago is still waiting for her treatment to start. Meanwhile, her cancer, unhindered, is undoubtedly doing what cancer does best. It is growing, unhindered. My wife found this on the internet. My cancer treatment has been cancelled and interrupted throughout this pandemic. I have found it hard as the nurses allocated to advise and offer support have been redeployed onto empty COVID wards, and so are unavailable to cancer patients. I have felt quite alone and unimportant compared to virus sufferers. How can anyone not be angry? What the hell is going on? Are governments trying to kill people? Is this some crude population control plan? It's not as if the problem is unrecognised. Governments have admitted that thousands and thousands of patients will die because they are being denied treatment. In the UK, it has been admitted that the closure of health services could lead to 150,000 deaths, far, far more than will ever die from coronavirus. I think that figure is a massive underestimate. The figures show that so far 60,000 people have died unnecessarily in the UK because they have been denied treatment. That is in the UK alone, and it is far, far higher figure than the number of coronavirus deaths. Why in the name of everything holy Do those deaths matter less than coronavirus deaths? The majority of people who died from the coronavirus are over 80 years old and seriously ill with other diseases. They would, it is admitted, have died within a few months anyway. This is exactly the same sort of way that flu usually kills so many people. But the patients with cancer being denied treatment are often otherwise healthy and frequently quite young. Around the world, tens of millions of operations have already been cancelled, and millions more get cancelled every week. All operations are essential, some more so than others, with the possible exception of some cosmetic surgery. No one has an operation they don't really need. Screening tests and investigations have also been abandoned and delayed. Patients with symptoms and signs of serious disease have been told they will have to wait months to find out if their problem are likely to kill them or are benign. In such situations, the waiting is almost unbearable. Only those who know the awful pain of waiting for test results will understand just how terrible the situation is at the moment. Moreover, doctors now report that vast numbers of patients have been so terrified by their government's hysterical overreaction to the risk that they won't go near a hospital in case they catch the coronavirus bug and die of that. Even when medical care is available, patients prefer to do nothing, and that probably is likely to persist unless the hysteria is reversed. I'm going to stop there. I know I've recorded this before, but only in a long slot. I think it's better in the smaller ones.